And happening today, we'll hear from IU Health on how they're handling Indiana's COVID surge as hospitalizations over the past few weeks have reached an all-time high. Now, we are told leaders will also discuss staffing, supplies and supply chain, and potentially restarting elective procedures. Now, if you recall, just last week, doctors at IU had said they are busier than ever. At Methodist Hospital, a FEMA team of doctors, nurses, and respiratory therapists have been helping out since late December. That was because of a surge in COVID admissions. Now, if you take a look at the most recent numbers, 56% of ICU beds are being used, 32% are from COVID patients, and only 11% of beds are available. Now, Methodist asked the team to stay on another month.
Well, they help from the emergency room, our med surg units, and in our ICUs. So we are scheduling them just like we would our own team. And really, I think the value of that FEMA team has been to not only provide direct patient care, but it's also been able to provide some relief to team members working alongside them.
Now, here's some promising news. Statewide hospital admissions are going down. 1 week ago, 305 people were admitted with COVID, and as of January 25th, there were just 56. So again, we are expecting to hear from IU Health leaders around 3 o'clock this afternoon. Of course, we will have more coverage starting tonight at 5. Well, the CDC wants pharmacies to quit turning people away with compromised immune systems who were seeking a fourth COVID shot. Our Lauren Kostick talked with a few people who struggled to get the help they need.
The CDC is clearing up confusion, telling pharmacies and clinics to stop turning people away who are immunocompromised and want a fourth shot.
Check-in process, I handed them my CDC card and they looked at it like confused for a little bit.
Last week, Adam Miller went to the Boone County Health Department to get his fourth dose. But before receiving his shot, workers weren't sure if he was eligible, an issue he's never had before.
I think that was really what triggered it for getting the shot, was me mentioning that my doctor recommended I come in and get that fourth shot.
Right now, fourth doses aren't recommended for the general public, but are encouraged for the millions of people with compromised immune systems. A change that happened back in October after the CDC approved the fourth shot as a booster for the high-risk group, on top of their 3 other doses. And in January, the agency shortened the waiting period from 6 months to 5. But somehow that messaging didn't reach everyone.
And I was next in line, and they told me, the pharmacist came and told me that they don't do fourth vaccine. She didn't notice that it was for a fourth.
Lynn Livingston also had a problem last week. She made an appointment at CVS for a fourth shot, but was quickly sent home, only to be called back later by the pharmacist.
Something came across her computer saying that she could do the fourth vaccine. She would hope that I would come back and get it, so I did.
Others have needed to show proof of medical records or a doctor's note, an issue CVS says it's addressing, and Walgreens is making every effort to update its staff. A frustrating obstacle for those most vulnerable to the virus, hoping this confusion gets cleared up soon.
All right, from Hamilton County, there's a mobile clinic open for people who want to get vaccinated or tested. The clinic is in Carmel, and it will be open from noon until 8 today through Saturday at the Jill Perelman Pavilion. Walk-ins are accepted, but they really ask you to make an appointment ahead of time.